Do you have these knots of tension in your muscles that just hurt? They might hurt all the time or just when you press on them. And when you press on them, you might feel pain in other parts of your body. The pain moves around. They might feel hot and then kind of ache and throb, and you might wish you could just escape from the constant pain and pressure. Oh boy, they're a lot of fun. In fact, these are called myofascial trigger points, and that's what today's video is about. I'm going to talk about what they are, why they happen, and what the standard treatments are. And why those standard treatments may provide symptomatic relief, they may relieve the symptoms, but that for long-term recovery you can do better. And if you stick around till the end, I'll tell you about a little known technique that actually does work in the long term, and I'll give you some tips for getting started with it. Okay, so who am I? My name is Ben O'Loughlin. I'm like a life coach for people who want to reduce or eliminate back pain without surgery, medication, or strenuous exercise. I recently helped a guy who had had back and neck pain from scoliosis every day for 30 years. He totally eliminated the pain within a week using what I teach. And so I actually teach an online course, which I'm currently making even more clear, efficient, and powerful, which means it's actually closed for now, but it will reopen soon. I'm taking applications for the waitlist. Now, I've reduced back pain days for my clients by 180. That means 180 days of people having back pain have gone away. My goal is to make it 1 million days of back pain saved. So, trigger points, and what have that got to do with me? Well, in my early 20s, I had daily neck, back, and shoulder pain, and I had a lot of these knots in my muscles, and I later found out they're called trigger points, myofascial trigger points. I tried yoga, I tried meditation, I tried medication. I had a massage once, and the masseuse said that I was the tensest person she'd ever massaged. It was not a proud moment for me. Everyone wants to feel like they're relaxed, but I certainly wasn't. On that day, she spent an hour trying to get these knots out, and I wound up very sore. The next day, I felt bruised, but a bit less achy. But within a week, it was back to my usual misery. So I tried a whole bunch of things. My shoulders were actually out of alignment. The right one was down by about 2 centimeters. My doctor said I had scoliosis. I went to a physiotherapist who just said, try and hold your shoulders straight. I thought, well, this stinks. However, I studied and I learned something called Alexander technique, which helped me drastically reshape how muscle tension was operating in my body. Now I'm pain-free, and I teach others how to reduce or eliminate back and neck pain. So today's topic, for trigger points, I'm actually no longer bothered by trigger points. Huzzah! But let's talk about them and what you can do about them if you are bothered by them. So first, a definition. Myofascial trigger points are painful nodules or knots in muscles. They're commonly found in the back, neck, buttocks, and shoulder, but they can actually occur in any skeletal muscle. A skeletal muscle is a muscle attached to the skeleton, as opposed to, for example, the heart, which is not attached to any muscles. Symptoms of myofascial trigger points: local tenderness, referred pain, muscle weakness, muscle twitch response to compression, so you push it and you get a little bit of a start, and a limited range of motion due to the tension of the muscle. Why do we get them? Well, they can form due to muscle overload, direct trauma, like you get a bruise and that can sort of harden up, psychological stress, or systemic inflammation. Trigger points are characterized by sustained muscle fiber contractions. Sustained muscle fiber contraction. That means all the fibers, muscles are made out of fibers, a bunch of fibers in a bundle. And if they're contracted in a sustained way, that means they're chronically contracted. This leads to reduced blood flow and increased pain sensitivity. So let's talk about that sustained muscle contraction for a minute. When you contract a muscle, you essentially squeeze the tissues, including the capillaries. Capillaries are these tiny blood vessels, these tiny tubes through which blood brings nutrients, including oxygen, to the tissues, to the muscle. So you squeeze. If you just squeeze your muscle for a second or two, it's no big deal. But if you sustain that contraction, you start to starve the muscle of oxygen and nutrients. Think about it like your kids are sitting next to each other. One reaches over and gives the other one's straw a squeeze while they're trying to suck on some milkshake. Very funny. But if they don't let go of that straw for a second, then we've got a problem. We may have a war on our hands. And that's what's going on. The straw is being squeezed off and the kid can't get the milkshake. Now, when the muscles squeeze off the capillaries, not only are we reducing the inflow of oxygen and nutrients to the muscle, but we're also reducing the flow that's supposed to go out, that normally takes metabolic waste products So I think lactic acid and the like, carbon dioxide. So not only can't you breathe and you can't eat any milkshake, but your toilet's backed up. It just doesn't get any better. So you've got this muscle that's wallowing in this ischemic state. Ischemic means lack of oxygen, not enough oxygen or nutrients, and too much muscle poop. Well, what can you do about it? So let's talk about the standard treatments. There are non-invasive treatments, invasive treatments, and lifestyle changes. Non-invasive treatments mean you don't break the skin, include massage therapy, stretching techniques like spray and stretch, where you spray something that chills the muscle and then you stretch the muscle and releases tension. Then there's active release tension techniques, trigger point pressure release, where you push on the trigger point and break up some of the holding there. Then there's invasive techniques like dry needling. You put a needle into the trigger point. You can inject local anesthetic or steroid or something like that into the trigger point, and you can use acupuncture as well. Then there's things like lifestyle changes. So these are not so concerned about the local effect on the muscle, but overall exercise, improved nutrition, and stress management. Now, before discussing the treatments in more detail, I do want to touch more on how they work and why they work and what the implications are. But let's talk a little bit more about chronic muscle contraction that causes ischemia. Just how is it that our muscles chronically contract? Why do they chronically contract? So let's have a little bit of engineering time here. Those who know me know I'm very keen on engineering time. Let's consider for a moment TNT, trinitrotoluene. It's a widely used military and industrial explosive. In 2023, the market for TNT was approximately $8 billion. Now, one of the most useful properties of TNT, other than the fact it goes bang, is that sometimes it doesn't go bang. It's impact resistant, in fact. That means it doesn't go bang just because you whack it or drop it or are otherwise careless. I'm going to skip the detail about blasting caps and how they work and keep it simple. If you don't know what they are, don't worry about it. They're just blasting caps, part of a stick of TNT. But the really important point is that stick of TNT doesn't ignite itself. It needs a signal. And in some respect, this is just like a muscle. A muscle doesn't contract by itself. It tenses, it contracts in response to signals that come down an axon, which is a long, thin nerve fiber, and it's part of a nerve cell or a neuron. It comes out of a nerve body, comes out and goes a distance, and then joins into your muscle fiber. And that's like a bit like the fuse of the TNT. The axon is a bit like the fuse of the TNT. The signal comes down the axon like the fuse burns or conducts the electrical impulse. So in this case, the axon is actually a bit like a tentacle that projects from what's called a lower motor neuron, which is a neuron that connects directly to the muscles. The main part of the lower motor neuron is called the body or the soma, and for the sort of muscles that we're talking about, the lower motor neuron bodies live in the spinal cord. So they're these tiny little things, the nerve cell, a neuron, just like the neurons in your brain actually, but it's actually not in your brain, it's in your spinal cord, and that is where it's like the nerve body. It's like in the movies where you've got a detonator box where you push the plunger down, and then that sends the message down the fuse or down the wires to blow up whatever it is that you want to blow up. So the detonator box is actually in the spinal cord. So you push down the plunger, the motor neuron fires, the message is sent down the axle to the muscle contracts. All right, so that's how come muscles contract. Now, sometimes in the movie you see the hero or heroine cut a wire at the 11th hour to disable the bomb. It's always, should I cut the red one or should I cut the blue one? And we know that if they cut the wrong one, then everyone blows up and it's a disaster, but somehow they know the right one. Once they've cut that wire, then the bad guy presses the detonator button and nothing happens. This is very disappointing for him, but it's very good news for the heroes. This cutting of the fuse is actually what happens when you damage the spinal cord and become a paraplegic or a quadriplegic. The signals can't get from the brain to the muscles, so they don't work. The muscles don't work anymore. The axon has been cut. Now, in the context of trigger points, you could say, therefore, in light of this information, that muscle contraction is actually a symptom, but the cause of that is a signal from the nervous system. So the nervous system causes the muscle to contract. Now, there's other things that may cause that part of the nervous system, to work, and we'll get into that later. Okay, so let's talk a bit about the signals from the nervous system. With TNT, once a single signal gets to the explosive, then everything blows up and the movie ends. One and done. With muscles, a single signal known as an action potential just causes a little muscle twitch. So we're talking about sustained contraction causing trigger points. Well, how is it that this is just a twitch? How is it that it's sustained? To generate and sustain significant force, you need to repeat the message. It's a bit like a 3-year-old kid who's just discovered the doorbell. Ding-a-ling-a-ling-a-ling-a-ling-a-ling. Each press of the doorbell sends a little blip called an action potential down the axon from the spine to the muscle. If you want rapid force generation, you're going to need up to 200 of these or more of these action potentials per second. I dare say your toddler can't manage 200 a second. They can probably manage 5. And in fact, to generate the sort of low-level chronic contraction that creates trigger points, couldn't find a study on this, but we're probably talking in the range of 5 to 10 times per second. The toddler might be able to manage that if they're quick on the draw. Okay, so let's talk about the cause behind the cause. It's not just the nerve cell body in the spine, the lower motor neuron, that makes a decision to send tension signals. The nerve cell is operating on instructions. The lower motor neuron from the spine to the muscle is like the last mile from the nervous system to the muscle. Where does the lower motor neuron get its instructions from? Well, it gets 2 places really. One is from local signals that are local to the muscle. We're talking about things like sensory neurons, like pain receptors, stretch receptors, and things like that. And they get them from upper neurons, which are from the brain or the brainstem. So there's instructions can come locally, or they can come from the brainstem, and they can get into the lower motor neuron either directly or by what's called spinal interneurons, which are like junction boxes. Anyway, that doesn't really matter so much. What does matter? Well, let's talk first about sensory inputs. When we've got a circulation deficit caused by too much contraction, and we have ischemia, the muscles respond to the ischemia and build-up of metabolic waste with pain. It hurts to have ischemia. This pain can actually goes via sensory neurons to the spine, and it can actually trigger more contraction in the lower motor neuron because the pain signal triggers that neuron. So the neuron that sends the contraction signal is listening to pain, and if the pain comes, it's more likely to actually trigger that and actually cause more contraction. Now you can imagine that might be a good idea in the short term. For example, the muscle might be struggling. You may have, injured it. You might need to immobilize it. But in the long term, it's a bad idea. It's maladaptive, which is a fancy way of saying it's a bad idea. Why is it a bad idea? Well, think about what can happen. Your muscle is sick from not enough blood flow. This causes it to send a pain signal to the spine. Your spinal reflexes respond to this pain signal by sending signals to contract the muscle that's painful. The contraction squeezes off the blood flow even more, and that's causing the problem. It's a negative feedback loop. It's a bad dynamic. We don't want it. So that's sensory inputs. Let's talk about upper motor neurons from the brain. So in the brain and the brainstem, there are what are called upper motor neurons. Now remember, the lower motor neurons are the ones in the spine, and there's axons that come down from the upper motor neurons in what's called descending pathways, and they have a different role to play. So if the dysregulated spinal circuits, the lower motor neurons and their sensory neurons, create this basic negative feedback that creates and sustains the trigger points. What does the brain have to say about this? Well, the upper motor neurons project their tentacles from the brain and the brainstem, and these descending pathways can amplify or reduce the 2 main factors in vicious cycle of trigger points, namely the pain and the contraction. They can inhibit the pain signal and they can inhibit the contraction. They can actually send signals to relax the muscle tension. So there are 2 places you can reduce trigger points. One is local to the muscle, and we looked at some of those techniques that do that. Massage, you're breaking up the inflammation or the adhesions, getting the oxygens, getting the circulation going on. Same with dry needling, spray and stretch, foam rolling. You're manipulating the muscle, and in some cases disrupting the pain signals to improve circulation, reduce tension, and reduce pain. So all very good. And these local techniques offer quick relief from the symptoms of trigger points, but there's not that great evidence that they would be leading to long-term improvements in the trigger point condition. So you go, you get a massage, it feels better for a few days, a week maybe, a month maybe, and after that it all comes back again and you need to go back again. Good business model if you're in the business of these manual treatments, because you'll have a patient for life. Then the other option from these local treatments is to modulate the spinal reflex loop, like what's going on at the spinal cord, modulate it from above, from the brain and the brainstem. And I'm going to teach you a small part of a method that can shift trigger points for good using this descending pathways from the brain and the brainstem. Let's talk about the listed treatments for lifestyle, so exercise, stress management, things like that. So what's the answer there? Don't be so stressed, don't be, exercise more, and these are great ideas. I recommend exercise, I do it. I recommend managing stress, I do that, and they're good. It's good general advice, but if there was a way to more directly activate the upper motor neurons that can reduce pain and contraction, would that be interesting? If there was a way to get your brain and your brainstem to send messages down to reduce pain and promote relaxation, does that sound like a good idea? Well, there is a technique to do that. It's called Alexander technique. Well, let me tell you a little bit about it. I'll skip the backstory about how Alexander technique was. I'll skip the backstory about how Alexander technique was discovered, why it's the best kept secret in trigger pain management, and what is the scientific evidence for it. Those are all topics I could go on for hours, but I'll skip that for this video. I'm just going to give you a taste of the skills you can learn to radically change patterns of tension in your mind and body. Now, what I'll show you today is just the tip of the iceberg. I could no more teach you the Alexander skill set in a single YouTube video than I can teach you to play a piano concerto in a single video. It's skill acquisition, but we can at least have a taste, we can get started. The student I might have mentioned is one student who had scoliosis pain for 30 years and found that the pain from knots of tension in his neck just disappeared in his first session, like the one you're about to experience. So quick fixes are possible. Sometimes it's quick, sometimes it takes a bit longer, sometimes it might never work. That's not been my experience, but there's no guarantees in life. I would also say that this stuff works better if it's live in guided practice, like I do on my course, but this is a start, this is free, this is a way to get going. Let's do it. Although, before we get started, I'm going to warn you, this is preposterous. It's preposterous to think that something so simple and, dare I say, woo-woo, can be a technique for retraining your primary motor cortex and your brainstem and the structures that sit upstream from those. My students regularly express that they kind of had to just restrain their cynicism in order to get the most out of this, because it seems preposterous. It seems, hippie, new age, I don't know, like this power of the secret or whatever. I don't know, whatever. But this stuff works. There's science behind it. Give it a shot. Because my students also regularly express disbelief at the difference that this makes. Before we launch into this, I also want to encourage you to talk to your doctor if you haven't been, about any symptoms you may be experiencing. What I'm about to share isn't a cure-all, although it may well be a help-all. It's not going to cure cracked vertebrae, but it may help, patterns of muscle tension around it. I don't know your medical situation, and I'm not a doctor anyway, so I can't give you medical advice. Definitely work that system. That said, that nothing I'm going to teach you here is incompatible with medical treatment, be it medication, surgery, manual therapy. In fact, there are scientific studies that show Alexander technique reduces back pain, but it's not the only thing that does. It may just be good as another technique in your toolkit. Okay, disclaimer time is over. Let's get to work. So we're going to practice something called inhibition. Inhibition has a specific meaning in neurology, neuroscience, but we're going to talk about it in a psychological sense. We want to send inhibitory signals down from our brain and brainstem to cool off that pain and tension in our spinal reflex loop, but we do that by inhibiting our mind and our intention. The science of Alexander technique is still in its infancy, so I don't have hard proof that descending pathways which descending pathways, if any, are the exact neuroscientific mechanism. I think it's plausible, and the bottom line is that this stuff really works. So take it seriously, see what happens. So find and sit in a comfortable place. So one of the main objectives we have here is not doing what we have been doing. In order to do something different, we have to first stop what it is that we have been doing, and that relates to creating and amplifying pain signals, and it relates to creating chronic contraction. And the way we do that with the mind is we start by stopping, by seeing if to what extent we can just quiet any. There'll be mental activity naturally, right? Our brains just, in Buddhism they talk about the monkey mind. So we can't necessarily press pause on all cognitive processing, but we do want to stop trying to fix whatever is bothering us with trigger points or more general pain. When we have that sort of pain, it's the most natural thing in the world to try and do things to not be in pain, whether it's tensing other parts of our body or doing these little micro adjustments, or even just having a psychological aversion to that pain and feeling anxious about the pain, feeling stressed, wishing it wasn't there, berating ourselves, hoping that it goes away. There can be all of this mental, psychological activity around the fact that we're in pain. And with inhibition, our job is to just stop that. Just let it go. You can have it all back again in 5 minutes. Just giving up on trying to escape from the pain isn't going to kill you. You can just have it. You can have all of that anxiety and all of that aversion back in 5 minutes. Just let it go for now. Stop any sort of adjustments that you might be making, any ways that you're trying to hold yourself to be more comfortable, or minimize, stop trying to fix your posture. Stop trying to change patterns of tension. You might need a bit of tension if you're sitting up. That's okay. Just go with the minimum that you need to not fall over. That's what's known in Alexander technique as inhibition. And this is a job for another video, but we actually want to clear out a bunch of habitual contractions and psychological tension. And we do that by a two-step combination, two-step process, and the first step is inhibition. So that's a little taste of inhibition. Just try it from time to time. What you will be doing, whether you know it or not, is just starting to unwind tension in those trigger points. Think about that as your first piano lesson. With the right guidance and practice, you can build skill in playing your nervous system like a piano. There'll be more videos that you can watch, and there'll be a link in the description if you want to follow it up further. But thanks for watching, and I will catch you next time.